Alright, so again, I'm just gonna state what happened. We found out that our dispensers are not complete. There's only one that's complete, so we're passing it around. And we're learning how to assemble it. So basically we're gonna take the cartilage. There's a white part to it and then a rubber stopper here. Okay. We're gonna take that upper part of the dispenser to hold it this way and then insert the cartilage in this way. That's the first step. Then we will take this part, make sure that we push this little button right here. It's going to release the spring. And then we're going to screw this on until it's tightly screwed on. So you're going to end up with this. Okay? And then we will take our assembled applicator. You always want to hold it by the lid above the cardboard. So you never want to hold it down here because that's where the needle is, right? You're going to screw this on like so, and you're ready to go. Okay? And I will show you on the slides, one last thing that we're going to do is you always want to bend the applicator as you would a probe, or the angle of a probe. So you take the lid and just kind of bend it like that. Okay, see how it's bent? It looks like a probe. It just makes it easier to deliver the gel that way. Okay, and you always want to use the lid to do that, to bend it with. Okay, because you don't want to use your fingers. Now when you are done with using the Oraqix, you want to do what's called a scoop technique. Whenever you recap a needle, even this blunt applicator, you don't want to touch this with your fingers. So what you do, and I'll help you guys, I'll walk around and kind of help you guys do this. You will lay your cap on the tray like this. When you're done with the Oraqix, you're going to go in and you're going to insert it like so, and then you will just turn it upside down so that you can push down on it. Okay? You need to have the lid secured. That's why you want to turn it this way and push down against the counter. We had an incident in the clinic, and it does happen sometimes. Luckily, it doesn't happen too often, but we had a student who was recapping a needle after she used it on a patient. And what she did was, she, instead of doing the single-handed scoop technique, she had it down like this. She took this, she had her thumb down here underneath the cardboard, and she went like this, and she stuck herself. Okay, so then that is kind of an issue. You know, we don't want to do that. So the single-handed scoop technique, like so. Okay? If you need to touch this just by edges, you can. It's sliding on me, so that's why I had to do it. Usually it won't slide on me, and you can just do it like that. And I have a video that will show you. Okay, so why don't we go ahead and practice with this. And you can go ahead, since you're going to practice first, go ahead and deposit some gel around the typodon too. So you're just going to take it and just apply it in a thin ribbon. You're going to see it come out. See how it's coming out? And you'll just apply it like this around the tube. Okay? See how it's coming out on its own? So you can take some gauze and wipe it. And then when you're done with that one sheet, you can pass it on to the next student. In the meantime, I'm just going to go ahead, and, or if you just want to do it in group and just kind of watch her, see what she's doing, and then pass it on, we can do it that way, okay? I'm going to go over the slides one more time as far as the assembly. You guys, if you want to take this in the clinic with you, if Dr. K says it's okay for you to use this, if you feel comfortable using this, we want you to feel comfortable using this. So if you need to practice, please stay. You know, I don't want you to have to sit here for another hour and a half. You know, I know it's slow just having one applicator, but if you don't mind staying, please practice maybe on just a little part of the tooth just to see how it works. So we can tell Dr. K that you guys feel comfortable, and then he may release you from, you know, not being able to use it. He may let you use it in the clinic, okay? And this PowerPoint that I put together, I think is going to be very helpful. You can take it in clinic with you, and if you're using it, you can refer to the PowerPoint. Okay? Any questions? Okay, so this is the assembly of the, you know, blunt tip applicator, and this is how we get the applicator. You want to isolate area. I like to dry the area. If there's a lot of saliva, it tends to get diluted really quick, and then it runs all over the place. So I do dry the gingiva a little bit. Some patients have a lot of saliva, so you want to dry the gingiva, maybe even use some suction to suction the water out. Apply, wait 30 seconds, and go under the gum, apply again. Okay? So see how I'm holding the cotton rolls around the teeth? That's how you want to hold your cotton rolls. You want to put one on the outside of the tooth, like toward the buccal, and then one on the lingual, but you have to hold it because otherwise the cotton roll under the tongue is going to move all over the place. So I like to hold it. And then I also add some gauze, behind the terminal molar as well on patients. And then this is the recapping video. It's kind of blurry, but this is the single-handed recap of a needle using I'm sorry, that's not it. This is different. Sorry, this is application of the Oraqix. I'm going to have a recap video showing you how to recap it. Okay?
Apply Oraqix around the gingival margins of the teeth you have selected using the blunt tip applicator included in the package. Pause for 30 seconds before subgingival application. Then go back and fill the periodontal pockets with Oraqix until the gel becomes visible around the gingival margin. In order to achieve anesthesia to the depth of the pocket, skillfully walk the blunt tip applicator around the base of the pocket. Pause 30 seconds before beginning instrumentation. It is important to note that the water spray from ultrasonics will not wash away the anesthetic effect. What we are observing is the application of Oraqix on tooth number 4 with a 5mm pocket. First is the application to the marginal gingiva. Pause for 30 seconds before subgingival application. Insert the cannula to the base of the pocket and dispense Oraqix. After the 30-second onset, the area can be rinsed prior to instrumentation if so desired. As you can see here, thorough instrumentation is very possible with Oraqix. In some patients with heavy calculus, it may be necessary to apply Oraqix in 2 stages. The heavy calculus on these teeth makes subgingival application of Oraqix into the periodontal pocket. In these situations, remove the heavy supragingival calculus to allow entry into the subgingival space. Removing the heavy supragingival calculus allowed the clinician subgingival access to place Oraqix into the periodontal pocket. Pause 30 seconds before beginning instrumentation. As you can see here, a 2-stage application of Oraqix on the patient with heavy calculus allows for very thorough instrumentation. Typically, Oraqix provides adequate comfort to adult patients during anesthesia in the periodontal pockets during scaling and root cleaning procedures. However, in clinical trials, a limited number of patients required an injection of anesthetic in addition to Oraqix.
Okay, so she had a good point. That's something I didn't put in my PowerPoint. I'm going to add it. Is when you're using a cavitron, which is an instrument that uses vibrations to remove calculus. I'll just kind of make it simple. You will learn more about it. But it's basically a metal tip that vibrates like 30,000 times a second. And as it hits the calculus, it gets it off the tooth. It has to use water to cool itself. They were just saying that you should know that if you use a cavitron, it does not affect the longevity of Oraqix. And basically, the Oraqix will still work really well, even if you're using water. Okay. And then another thing that was really good was that she mentioned was that if you have a lot of tartar, a lot of calculus on the tooth, it's very important to remove some of that subgingival calculus so that you can get into the base of the pocket of the sulcus when you're administering Oraqix. Now, girls, the ones that had a chance to try the Oraqix and kind of disassemble it, assemble it, if you want to just maybe self-evaluate yourself and write a little sentence about what you thought about the exercise, here's a little handout. It's basically self-evaluation. How well do you think you did? You did great. And then I think you guys are doing great. And then you can go, once we're done with the disassembly portion of it, I just want to go over that real quick. Yeah. Here you go. Okay, that's nice. Yeah. Thank you, I appreciate it, girls.
I got one.
numbers, but so we just got a few more slides to go, and then video, and then I'll be here and I'll help you guys on this side when you get the Oraqix. I'll help you work with it.
How high is the score? Like 5?
I'm sorry?
Like how do you want us to score it?
There is like, not knowing it at all, feeling okay with it is 2. So not knowing it at all is 1. Feeling okay with it is 2, but needing improvement. And then 3 is knowing it, not needing any improvement. Okay. Okay, so you guys, disassembly, the way we're going to disassemble it, let's first use this video to look at the recapping. So when you're done with it, you need to recap it using the single-handed scoop technique, right? And so this will review the technique real quick. So I'll be able to. That's the phone. Okay, here we go. So this is what you would do, sorry. Wrong video, hold on. Okay, it didn't download. So there's a video on YouTube, I may find it in a bit, but it shows you how a dentist recaps a needle. So it's basically the same thing that I showed you. He just takes the syringe, he has the lid on the tray, then he goes and recaps, turns it upside down, pushes it down on it. If you guys are okay with the way I showed you how to recap, then you're good to go. Did everybody see me demonstrate? Okay.
Yeah. Do you want us to write the content paper?
Okay, so tips and tricks for me. As soon as you recap the Oraqix, you want to take it to the lab, and you'll be disassembling. Okay. So in the lab, you guys, your blood needle applicator goes into the sharps container. Does everybody know where the sharps container is? So the needle will go into the sharps container as well as that cartilage. You have to look at the cartilage when you remove it to remember how much you used. Because when you write your progress notes, you need to write down exactly how much of it you used. So always look at the cartilage before you throw it into the sharps container to see how much you used. And then it goes into the sharps container like this. Okay. And then the applicator itself, so the dispenser itself, you cannot, remember this, you cannot spray it with any kind of cavicide or anything like that, okay? If you want to wipe it down with cavicide, you have to put some cavicide on a gauze and then wipe it down, but you cannot spray the plastic directly with cavicide, so that's important. And it can only be steam sterilized, so it cannot go into the cold solution, the cold sterile solution, the glutathione. It won't be able to go in there. It has to go through the steam sterilization. So you need to put it in one of those blue baggies. You put the 2 parts together, seal it, and then put it into the autoclave, and it gets steam sterilized. Okay? And then we're going to talk about the progress notes. So when you use Oraqix or any kind of anesthetic, we have a protocol or a template for you that you can use as far as recording the procedure in progress notes. So what you would say is, okay, Ms. Johnson came in today for non-surgical periodontal debridement, performed, an SBT on upper right quadrant using, Gracie's and a Cavitron, had used Oraqix prior to procedure to anesthetized area, used, and then you will write Oraqix gel, 2.5% pilocaine, 2.5% lidocaine, on teeth numbers 2 to 6 in upper right quadrant, used half a cartilage. So you would, add that depending on how much you use. Either use the full cartilage or use half of the cartilage. So you want to indicate that. And then patient tolerated procedure well, or if the patient didn't tolerate it well, then you want to write in your notes what happened. So like in my case, the first time I used it, I would say, John had, experienced some anesthetic in the back of his throat, due to some of the Oraqix, kind of moving down along the tissue or whatever, So you want to explain exactly what happened and how the patient did. I want to finish that story. After my experience with the Oraqix, I learned a huge lesson on isolating the area. And I spoke in Chicago. There was a huge conference in Chicago, and I was attending one of the seminars, and they were going over new products. And the speaker asked if somebody in the audience had ever used Oraqix, that it was like the latest thing out there. And like out of 500 people, I was the only one who stood up. And I had huge stage fright before I became an instructor. Like I couldn't talk in front of people at all. And here I was talking in front of like 500 people. But I told everybody my story. You need to isolate the area. That is really, really important. Okay? So thank you everybody so much for participating. And does anybody have any questions before I turn off my camera? Everybody good? Okay, and I'm here if you guys, I'll talk to Dr. K. And I will let you know what he said as far as allowing you guys to do this, okay? I will make sure that everybody had a chance to get their hands on this, so I will vouch for you guys and tell him that, you did have a chance to practice on the typodon, okay? So thanks so much. Let me turn off the camera.
I actually do have one question.
You do have a question? That's awesome. I love questions.
Since we're scaling, like they said that we'll be scaling in quads, so if we can use this instead of the needle, we can do all 4 quads in one day rather than splitting up the equipment.
Not necessarily. It's a really good question. Not necessarily, because, okay, let's say you have, depends on the patient type, okay? So if you have a type 1 patient who has only some localized calculus, let's say on the linguals of lower anteriors and the buccals of the upper molars. Otherwise, we're basically doing deplaquing. The periodontal pockets are 4 millimeters or less with localized bleeding on probing. It's possible that you may finish them, but I think at this point, I would not count on getting them done in one visit. Think of how long it takes you just to do the paperwork at this point, right? And then the radiographs, right? Are you just talking about purely scaling?
No, I mean, to be able to, instead of splitting up, they said that we would do, like 1 in 4, like if we do
okay,
1
so
in
you're
4.
talking, so you're talking about a different type of patient. You're talking more about a patient who does have some form of periodontal disease. Right. So we always want to split it up into 2 halves, no matter what. Okay. It's just very stressful for the patient to sit through. I don't think you could get all those 4 class done. The Oraqix will allow you to get started though, and to actually do it. Okay, so if the patient doesn't have really, really deep pocketing, and if Oraqix helps them, I would go 1 by 1 quad only. I would chart your quadrant. I would use the Oraqix, I would scale the quadrant, and then move on. I think at this stage in the game, I think you guys will do really good if you're done with 1/2 of the mouth in 1 3-hour visit. I think that would be good. But the Oraqix is going to allow you to move along. You don't have to wait for an instructor. If you can use the Oraqix, then it'll help you kind of get more done. But it won't make a difference as far as between getting half a mouth done or 1 whole mouth done, because we don't usually, with scaling, we don't usually get more than 1/2 of the mouth. So 2 quads at a time, that's a good plan. And yes, it would make it, if we had 6 or 5 hours, yes, we could probably do it, because what you're probably referring to as far as anesthetic, local anesthetic, is that if we're using local anesthetic and we're anesthetizing the mandible, we get that half of the tongue numb. So it is not something that we recommend, that anybody would do in dentistry, is to numb up the entire jaw. Usually it does not happen, because you want to be able to use your tongue to some extent, right? I mean, can you imagine? So this would allow.
You said the numbness only lasts for 20 minutes.
Right, and it doesn't affect the tongue. So, like theoretically, if you had enough time to do the whole mouth, using the Oraqix in localized areas, you could. But I'm just saying that if you have a non-surgical therapy patient that has deep pockets kind of everywhere and a lot of calculus, subgingival calculus, it's just so time demanding as far as your technique and how much you're doing, and then the patient has to stay open for a long time. It's hard on the patient. We would not recommend doing more than the 2 flaps. But you could possibly do it as far as using Oraqix for anesthetic. It would not limit you as a local anesthetic board. You could not numb out all the quads with local anesthetic, but you could use the Oraqix in all 4 quads with maybe a slight type 2 or something. Does that answer your question?
Yes.
Okay.
Yes.
Any other questions?
So like
That's a good question.
after the 20 minutes, you reapply it? Like
After the 20 minutes, you want to check with your patient first.
Okay.
Okay, so, I mean, if you want to be proactive, you could after 20 minutes, but it's going to be, as far as the longevity of Oraqix, it's going to depend on the patient. So not everybody's going to need it in 20 minutes. Someone may need it in 10 minutes. You may need to reapply it. Okay, so you just kind of have to watch your patient for nonverbal signs and then communicate with them. Hey, Sarah, are you doing okay? Are you still okay? And then reapply it as you need to. That's kind of the beauty of Oraqix, is that it's right there for you. It's right there, and it's the application, the ease of application is fairly good, and it's a great tool. But again, I don't want you guys to think that it replaces local anesthetic. I want you to really, truly, clearly know when you should be using local anesthetic. And with, true perio patients, I tend to go for local anesthetic first, okay, with my perio patients. And it's something that you put on the treatment plan. Since we're talking about this, I just want to hit on something that I see in the clinic that I don't think you guys want to do. And so let's talk about it, okay? Do not tell your patient when you guys are treatment planning and the patient is a type 3 perio, they have a lot of subgingival calculus, a lot of bleeding, a lot of edema. You want to treatment plan that anesthetic, okay, for your scaling inward debridement. Do not ask your patient if they, do you, sometimes I hear, someone say, oh, do you think, Judy, that we should use anesthetic on you? Do you think we should? Would it be okay? The patient doesn't know. They don't know that it's going to hurt. They don't know what's going on. You're the one who is making the decisions, and just think about it. If you had infection around your teeth and someone was going on the roots of your teeth with a metal instrument, scaling, would you not want to be anesthetized? So, in your professional opinion, you guys, the standard of care out there, you want to go by the standard of care. And the standard of care is getting your patients comfortable. That means using anesthetic when indicated with perio patients. So I want you to believe in yourselves as professionals. You know what's best. Either you know what's best or your instructor knows what's best. Okay, so I don't want you to feel like you cannot make a decision on this. Okay, you can. But don't throw the ball into the patient's corner. Don't ask the patient to know what's necessary in order for them to get treated. They don't know. They really don't know. So, now it's a different issue if you're going to treatment plan anesthetic and you're going to say, okay, John, this is what we're going to do next time. You have a lot of subgingival calculus. It has built up over time, over a long period of time. We have to get this off your teeth. And then explain to him why we have to get it off, okay? Now, we're going to use some anesthetic to make you comfortable. We're going to have to go under your gum, and we're going to use some anesthetic to make you comfortable, and so that I can go in there and do my job. So I always say, you'll be a much happier camper if we do this. We're going to use anesthetic. You're going to be able to relax. So you do want to inject a little bit of positivity into something that's not really positive. Like you said, you never look forward to anesthetic, and no one does. Nobody likes needles. But you want to have a sense of, or show the patient a sense of just positiveness about the procedure, and that, we'll be able to do our work and we'll be able to get you better. So, think of it this way. When you have a filling done, does the dentist ask you, oh, is it okay if I use anesthetic? Does it? So think of it that way. Can you think of it that way? Okay. Now, it can happen where the patient says, oh, absolutely not. Or they're going to say, is that a needle? The local anesthetic, is that a needle? Well, yes, we're going to use, that setup for local anesthetic to penetrate the tissue. Absolutely not, we're not doing it. You're not going to give me a shot. By the way, you don't want to use the word shot. I'd rather use the word anesthetic than, oh, we're going to give you a shot. So in that case, you can reach for Oraqix with patients that have perio, more advanced perio, and say, okay, you know, I do want to take the edge off for you, and I want you to be comfortable. If you know, I do recommend the local anesthetic, but you know, if you don't want to do that, you know, let's try the gel. Let's try the Oraqix gel. And then you're going to explain to them exactly what you're going to do with the gel, okay? But you're going to tell them, okay, but your periodontal disease is advanced. We have a lot of inflammation, and sometimes even with the local anesthetic, because of the inflammation in the tissues, which are very acidic, and they're kind of clashing with the anesthetic, it's hard to get the teeth numb even with local regular anesthetic. So it's possible that even when I use this gel on you, you will still feel it, and please let me know if you do. And let me know if I can administer local anesthetic. So you're telling them, okay, let's compromise, let's try this. I don't want to just go in without nothing. I want to try something to help you. But, you know, I need to do my job. I need to get in there, and you need to let me know whether you're comfortable or not. And there's always that option on the table to do the regular local anesthetic, which will take all the pain away. It will take all the pain away. And it's amazing when you approach it this way, ladies. It's really amazing how your patient reacts. Really amazing. I mean, if you have a patient that does not want to do the local anesthetic and the Oraqix is not working, and they're just jumping, you know, out of the chair every time you go in and you can't do your job, get me. I would say 85% of the time, with my way of addressing it, I get them on board with us. I get them on the same page. And boy, are they glad that they did it after they have it. Okay, so just a few words on that. I know I went kind of into a lot of detail, but I think it helped. So, thank you.